Good morning, everyone. I'm delighted to share HP Plus's policy scan and action planning approach and associated tools to you today. Please be a little patient with me with technology. If you have any questions along the way, feel free to type that in the chat, and we'll have a little bit of time at the end to take questions. Developed early on in the HP Plus project in response to the U.S. government PEPFAR's request that all countries conduct a legal and regulatory analysis to inform planning, we found that there was a need to conduct a more rapid and inclusive scan of the policy environment. And we developed this approach. Applied in several countries, and I'm here to share this with you today. I want to highlight that if a civil society or government entity has access to legal and regulatory analysis skills, as well as facilitation and stakeholder engagement skills, they can apply this approach and the tools that we've provided, which are included online, on their own, and can also receive support from implementing partners with these skill sets. We've streamlined the approach and made it inclusive to ensure that the analysis is really targeted and focused on the issues that are important to the country and the issues that are most important to stakeholders. This tool was developed with HIV in mind, but the same approach and the same tools can be used across any health area. So the first step is to start by analyzing existing data, existing programmatic data, existing policy analysis data, to be able to present to a group of stakeholders. We try to ensure that this is cross-sectoral and includes government entities, includes civil society organizations, organizations representing marginalized populations, private sector. We want this group to be as inclusive as possible in order to help set the priority service gap. That group, through a workshop setting, will identify and prioritize the service gap. And then we engage in discussion during that workshop to understand the real implementation context. And the idea there is that what happens in a policy document, what's written in a policy document, and what happens in reality are often very different things. And so we want to try to understand how a policy is actually being implemented. Based on that prioritization process, we then engage legal and regulatory expertise in country to really analyze all of the policy documents on that topic, and to better understand how those policies are being implemented at different levels. So usually the service gap is a result of a gap in implementation. And even if a policy is in place, it may not be complete. It may not map to best practices. So we use global best practices, best practice documents and model laws to be able to compare those to the local legal and regulatory documents. Based on that analysis, we bring that to a second workshop gathering of stakeholders to demonstrate and show to the stakeholders what their legal and regulatory environment looks like, what information we were able to gather about what's happening in practice. And they further define an advocacy issue, the policy and issue that they really want to dive into and address. Through that process, they develop an advocacy strategy, a plan, and then receive support if needed to implement that plan. I'll go through an example shortly from Lesotho, but based on that whole process, we're able to document some of the service gaps, the legal and regulatory barriers and gaps, We're able to document challenges in policy implementation and use that information directly and immediately in action planning. So here's an example of the advocacy strategy that was developed by stakeholders in Lesotho. Through this process, they identified that HIV testing services were not functioning as they wanted. They were not seeing the yield that they wanted to see. So we looked into all the potential policy issues that needed to be addressed related to HIV testing. That included self-testing, it included PrEP, and partner notification. And following the legal and regulatory analysis and analysis of implementation, in that second workshop, the stakeholders identified partner notification as the issue that they really wanted to address. They noted that there was a window of opportunity, that the partner notification and HTS policy was coming up to be revisited and revised. This opportunity was presenting itself, and it was a good chance to advocate for the addition of partner notification strategies to be included in the next HIV testing policy. So after, with the use of the data that was collected in the legal and regulatory analysis, these stakeholders sketched out this strategy that highlighted different stakeholders that they could influence, that highlighted exactly the type of issue that they wanted to address. And they actually implemented the action plan, including partner notification in the HTS policy during the next round, and that policy was approved. So some lessons learned for us across several applications of this approach and associated tools is that CSOs and government entities with the capacity in legal and regulatory analysis, or the ability to access that capacity, can use the tool independently. They were able to take some of the templates that we had and run with them. We found that targeting the legal and regulatory analysis to the service gaps that people were identifying was really a great opportunity for stakeholders, and it helped them realize that they didn't have to do a broad legal and regulatory analysis across HIV, wait for a long period of time for the results. They could hone in on the things that they felt were most important. It also links, very importantly, policy interventions to service delivery. We find in our work that there can be a lot of confusion about what effect policy has on service delivery and how we can scale up good practices. This is one of those clear opportunities for stakeholders to see that link. And also, by targeting the analysis, it helps to ensure that it remains very context specific and locally led. Finally, immediately facilitating use of those findings is key, really, for any analysis, and particularly for legal and regulatory analyses, to make sure that the findings don't just sit on the shelves. So I'd like to open up the floor to any questions that you may have. And if you don't have any questions, I'll actually include some questions for discussion in the chat. I'd love to hear any challenges or barriers that you all have faced to conducting legal and regulatory analysis. And I would love to hear tools that you might have used in the past, as well as any questions you might have for me. Hi, Cindy, thanks. So Cindy asks if we have any similar tools for other health areas. We do have other published tools touching on medicated assisted therapy for harm reduction programs. We do not have the exact same tools for lots of other health areas, but the templates and approaches can be applied across the board. They're not, just HIV specific. It does require that the organizations supporting it and the stakeholders engaged have access to global best practices and global clinical policies on that particular topic. So it's usually best to engage individuals who have that knowledge of some of those global documents and best practices to bring to the discussion. Oh, Omar?
Yes, thank you, Nicole. Very good presentation. So I just wondered about the, as you did the legal and regulatory analysis. So how about the capacity for implementation? Like also did this analysis considered whether the entities, that you work with have the capacity to implement? Because I remember you also did one regulatory analysis, and that was the regulatory analysis of the Ministry of Public Health in Afghanistan to see what legal documentation existed in relation to private sector and what was the capacity. And of course, we identified a lot of overlaps in roles and responsibilities and lack of unorganized structure, staffing, and resources to implement. So in your case, like what was the indication of that? Thank you.
So we did, through a few different applications, we were also gathering information on capacity to implement policy. We did that in a few different ways. We had key informant interviews to better understand how different perspectives, from different perspectives, the policy is being implemented. We captured perspectives of healthcare providers, of clients and marginalized groups who may not have equitable access. We gathered information from donors, and then of course from government entities. And depending on the setting, that may be both at the national and decentralized level. For instance, in Ukraine, we've used similar tools, and we're able to understand how the policies might be implemented differently in different decentralized settings, depending on the capacity locally. Unfortunately, I have to wrap up now, and we'll move on to the next session. Thank you very much. You can find more information here on the slide on HP Plus's website. Have a great day.